Have you ever rolled over in the middle of the night, glanced at the clock and sighed when you realized it's 3 a.m. again? You're not alone. Early morning awakenings are one of the most common sleep complaints among older adults. In fact, more than half of people over 65 report some type of recurring sleep problem, and many find themselves waking several times each night. In this video, we're going to explore why this happens. We'll dive into the science of sleep as we age, explain the habits and health conditions that can make 3 a.m. wake-ups more likely, and share practical tips to help you sleep through the night. By the end, you'll understand that this isn't about weakness or laziness. It's about biology, lifestyle, and sometimes treatable medical issues. Number 1. Changing sleep architecture. To understand why you wake up at 3 a.m., it helps to know how sleep works. During the night, you cycle through stages of light sleep, deep slow wave sleep, and rapid eye movement, REM, dreaming. Normally, these cycles repeat several times, and as the night goes on, you spend more and more time in lighter stages. That's true for everyone. However, aging alters this pattern. According to the U.S. National Library of Medicine, older adults still log roughly the same total hours of sleep, but they spend far less time in deep, dreamless sleep and experience abrupt transitions between sleeping and waking. Because your brain lingers in lighter stages longer, you're more vulnerable to waking up from sounds, movements, or even minor shifts in your body's rhythms. Medline Plus notes that older people typically wake up 3 or 4 times each night. That's why you may feel like a light sleeper, even though you're spending the same number of hours in bed. Those brief awakenings can cluster around the early morning hours when light sleep dominates, setting the stage for the 3 a.m. problem. Number 2. A shifted internal clock. Another biological reason for early wake-ups is a phenomenon called phase advance. You've probably heard of the circadian rhythm, your internal clock that tells you when to feel sleepy and when to be alert. In younger adults, that sleep window occurs later in the evening. As we age, the clock gradually shifts forward. UCLA Health explains that older adults spend more time in light sleep and their circadian rhythms move earlier, causing them to go to bed sooner and wake up earlier. In some individuals, this shift becomes extreme and is known as advanced sleep phase syndrome. Research shows that people with this condition naturally fall asleep between 7 and 9 p.m. and wake up about 8 hours later, around 3 to 5 a.m. Even if you try to force yourself to stay up later, your internal clock still has you wired for a pre-dawn wake-up. On top of the earlier timing, the strength of your circadian rhythm diminishes with age. The hormones that support your sleep-wake cycle, including melatonin, decline over time. When the rhythm's amplitude weakens, even small disturbances, a creaking floorboard, a change in temperature, can jolt you fully awake. Understanding that this forward shift and weakening rhythm are normal parts of aging is the first step toward accepting your 3 a.m. wake-ups and learning how to manage them. Number 3. Hormones at play. Hormonal changes further complicate sleep in later life. For women, menopause brings a sharp drop in estrogen and progesterone. Harvard Health points out that these declines trigger vasomotor symptoms such as hot flashes and night sweats, which commonly wake women after age 55. The Sleep Foundation notes that nighttime awakenings during and after menopause often coincide with these hot flashes and sweats. Even apart from menopause, the body's production of melatonin, sometimes called the darkness hormone, because it signals your brain that it's time to sleep, decreases with age. With less melatonin to reinforce your sleep drive, your body may think it's time to wake up even if you'd rather stay asleep. Meanwhile, cortisol, your stress hormone, naturally rises toward morning to prepare you for the day. If you're under chronic stress, that cortisol surge can creep earlier and become exaggerated, pushing you out of bed prematurely. While cortisol rhythms aren't cited directly in our sources, managing stress is a key strategy for minimizing early awakenings, and we'll cover that shortly. If hormonal shifts are contributing to your sleep problems, talk with your healthcare provider. hormone replacement therapy, or lifestyle modifications might provide relief. Number 4, the midnight bathroom break. A very practical reason many seniors wake at 3 a.m. is the need to use the bathroom. Nocturia, waking during the night to urinate, becomes more common with age. The Sleep Foundation explains that nocturia can result from drinking too much fluid late in the evening, an overactive bladder, an enlarged prostate, or other conditions like obstructive sleep apnea and diabetes. Bladders tend to hold less urine as we grow older, and the urge to urinate can feel more urgent. Some medications, particularly diuretics prescribed for blood pressure or swelling, increase urine production and contribute to nighttime bathroom trips. The Cleveland Clinic recommends limiting fluids in the hour or two before bed and consulting a doctor if nighttime urination becomes frequent. If an underlying bladder or prostate issue is to blame, treating it can improve your sleep substantially. Likewise, adjusting the timing of diuretic medications with your doctor's guidance may reduce nocturia. Number 5, hidden sleep disorders. If you're wide awake at 3 a.m. and counting sheep, a sleep disorder may be involved. Insomnia isn't just about difficulty falling asleep, it also encompasses trouble staying asleep. The Sleep Foundation observes that awakenings lasting more than half an hour are characteristic of insomnia, and the condition becomes more common with age. Obstructive sleep apnea, OSA, is another common culprit. OSA causes your airway to collapse during sleep, leading to brief breathing pauses that rouse you. Many people with apnea don't realize they have it and may attribute their wakings to a full bladder. Cleveland Clinic notes that sleep apnea is most common during REM sleep and becomes more prevalent as we get older. Restless legs syndrome, RLS, and periodic limb movements can also disrupt sleep. These conditions cause uncomfortable sensations or involuntary jerking in the legs just as you're drifting into deeper sleep. Cleveland Clinic points out that restless legs syndrome is more likely to develop with age, but is usually very treatable. Beyond these, circadian rhythm disorders beyond advanced sleep phase, such as an irregular sleep-wake rhythm, can keep you awake at odd hours, and nightmare disorder can jolt you awake in the early morning. If you suspect a sleep disorder, don't ignore it. Diagnostic tests like sleep studies can reveal whether you have apnea, RLS, insomnia, or another issue. Effective treatments exist: CPAP machines or oral appliances for OSA, medication or supplements for RLS, and chronotherapy or light therapy for circadian disorders. Getting a proper diagnosis and treatment can transform your nights. Number 6, stress, anxiety, and mood. Sometimes the alarm clock inside your head is internal rather than external. The Sleep Foundation describes sleep reactivity, the tendency for your sleep to be disrupted by stress. People with high sleep reactivity, particularly women and those with certain genetic traits, find their nights fragment during stressful periods. Cleveland Clinic adds that racing thoughts and worries related to stress, anxiety, or depression can jolt you awake and keep you from returning to sleep. Depression is especially sneaky because it can alter the body's internal clock and make you feel alert when you'd normally be asleep. It's also worth noting that sleep problems are a hallmark symptom of depression. Addressing mental health isn't just about daytime well-being, it's essential for good sleep. Techniques like deep breathing, progressive muscle relaxation, meditation, and journaling can help quiet a busy mind before bed. If chronic stress, anxiety, or depression are getting in the way of your rest, seek professional help. Cognitive behavioral therapy can be effective for both insomnia and mood disorders and can help you develop healthier sleep patterns. Number 7, environmental disturbances. Your bedroom environment can also explain why you're awake when the clock reads 3 a.m. Noise and light are more disruptive when you're in light stages of sleep. The Sleep Foundation notes that nighttime noise, from traffic, electronics, or even a dim nightlight, can cause you to wake. Since we spend more time in light sleep as the night progresses, you're easier to startle just before dawn. Cleveland Clinic explains that light shining into your retina tells your brain it's daytime. So even if you fall asleep in a bright room, your brain may not stay asleep. Noise, such as sirens or a television in another room, can similarly jolt you awake. External disturbances are especially likely to wake you during REM sleep, which occurs in the early morning. Temperature plays a role too. An overly warm or cold bedroom or hot flashes related to menopause can bring you out of sleep. The fix is straightforward. Make your sleep environment as dark, quiet, and comfortable as possible. Use blackout curtains or a sleep mask, and try earplugs or a white noise machine. Adjust the thermostat or bedding layers to keep your body at a neutral temperature. Avoid using your phone, tablet, or computer in bed. The blue light signals your brain to wake up. Number 8. Lifestyle habits that interfere. Our habits can either support sleep or sabotage it. Napping is one such culprit. Although a brief midday rest can feel wonderful, Cleveland Clinic warns that naps often undermine nighttime sleep. If you work nights or have a medical condition that requires rest, naps may be necessary, but otherwise try to avoid them or limit them to 20 minutes earlier in the day. Alcohol is another myth. A nightcap might relax you initially, but Cleveland Clinic notes that alcohol fragments sleep and leaves you more tired. Alcohol also increases urine production, contributing to those middle-of-the-night bathroom breaks. Caffeine and nicotine act as stimulants. Medline Plus advises avoiding caffeine for at least 3 or 4 hours before bed. Heavy meals eaten close to bedtime can cause indigestion and are linked to more nighttime awakenings. The Sleep Foundation cites a survey showing that late meals increase the likelihood of waking at night. They recommend avoiding meals during the 3 hours before you plan to sleep. Physical activity and sunlight exposure are crucial. UCLA points out that reduced physical activity and less daytime light can disrupt circadian rhythms. Conversely, the Sleep Foundation suggests that increasing your exposure to daylight, especially in the morning and late afternoon, helps you sleep better at night. Exercise earlier in the day boosts deep sleep, but avoid vigorous workouts within 3 hours of bedtime. A consistent sleep schedule is another powerful habit. Going to bed and getting up at the same time every day, even on weekends or in retirement, helps anchor your internal clock. Number 9. Health conditions and medications. Underlying health issues often play a role in nighttime awakenings. Pain from conditions like arthritis, back trouble, headaches, or muscle cramps can wake you and make it difficult to settle back to sleep. Cleveland Clinic lists pain among the reasons people wake up at night. Chronic diseases such as heart failure, arthritis, and Alzheimer's disease are also associated with sleep disruptions. Breathing and airway diseases, including asthma and chronic obstructive pulmonary disease, COPD, can make breathing more difficult at night and disrupt sleep. Sleep-disordered breathing becomes more common as we age. Large studies show that the prevalence of sleep apnea and related breathing disorders increases significantly after age 60. Endocrine conditions, like diabetes, vitamin D deficiency, and hyperthyroidism, are linked to poor sleep quality. Neurological disorders such as dementia, Alzheimer's disease, and Parkinson's disease are also associated with frequent nighttime awakenings. Medications deserve special mention. Steroids, diuretics, and some antidepressants can cause nighttime wake-ups. Cleveland Clinic notes that medication side effects are a significant factor in sleep disruption. If you suspect a medication is affecting your sleep, talk to your doctor. Do not stop a prescribed drug on your own. A healthcare provider can adjust the timing or dosage or recommend an alternative. Number 10. Retirement, routine, and social life. Lifestyle changes after retirement can also unsettle your sleep. Without a work schedule, you may stay up later or sleep in, causing irregular sleep and wake times. UCLA notes that reduced physical activity, fewer social interactions, and less daylight exposure can weaken your circadian cues. Boredom or loneliness may lead to daytime napping or late-night screen time, both of which erode sleep quality. The solution is to build structure back into your day. Make a habit of going to bed and getting up at consistent times. Schedule activities, exercise classes, hobbies, social visits during daylight hours. Seek out sunlight by walking outdoors or sitting near a window. When you maintain a regular routine, your internal clock stays stronger and is less likely to wake you before dawn. Number 11. Practical strategies for better sleep. Now that you know the causes, let's recap some solutions. First, improve your sleep hygiene. Establish a calming pre-bed routine, dim the lights, read a book, stretch, or meditate. Keep your bedroom dark, quiet, and cool. Use blackout curtains or a sleep mask, and earplugs or white noise to block disturbances. Limit or avoid stimulants and depressants in the evening. Skip caffeine and nicotine for several hours before bed, and don't rely on alcohol to sleep. Finish meals at least 3 hours before bedtime. Reduce fluid intake in the last hour or two before bed to minimize bathroom trips. Move your body and get natural light during the day. Exercise improves sleep, but avoid vigorous workouts too close to bedtime. Spend time outside or near a window to boost your daytime alertness and nighttime sleep. Stick to a consistent sleep and wake schedule. Your internal clock thrives on regularity. Manage stress through relaxation techniques, prayer, journaling, or therapy. If you suspect a sleep disorder, chronic pain, or medication side effect, talk to a healthcare provider. Sleep studies and medical evaluations can identify treatable conditions like sleep apnea or restless leg syndrome. Remember, you don't have to solve this problem alone. Professionals can help. Final conclusion. Waking up at 3 a.m. every night can be frustrating and exhausting. But as we've learned, there are many reasons behind those early morning awakenings. Natural changes in sleep architecture, a shifted internal clock, hormonal fluctuations, bladder function, sleep disorders, stress, environmental disturbances, lifestyle habits, chronic health issues, and medication side effects. The good news is that many of these factors are manageable. By making strategic changes, improving sleep hygiene, adopting a regular routine, treating medical problems, and caring for your mental health, you can reduce the frequency of those 3 a.m. wake-ups. Remember that it's normal for sleep to evolve as we age, but restful nights are still possible. Experiment with the tips we've discussed and consult your healthcare provider if sleep problems persist or worsen. With the right approach, you can reclaim those quiet hours of the night and wake up feeling more refreshed.